Okay, yes, it is 4 p.m. In Addis, right? And 9 a.m. in New York. So my name is Adel Abdul Latif. I am in charge of the United Nations Office for South-South Cooperation. I am delighted that the first webinar in my new assignment is focusing on Africa and mainly focusing on women in science, technology, mathematics in Africa. Let me start first by addressing the distinguished panelists, the Excellency Ambassador Duarte Thomas Kwesi, Deputy Chairperson of the African Union Commission, Honorable Stella Nbani Abrams, Minister of Communications and Digital Technology of South Africa, Professor Sarah Akbar, AUC Commissioner for Human Resources, Science and Technology. Distinguished presenters and dear participants, I would like at the beginning to start to welcome you on behalf of the United Nations Office for the South-South Cooperation that I represent to this high-level webinar on African women in STEM and their contributions to COVID-19 response. As all you know, the United Nations General Assembly has dedicated the 11th of February as the International Day of Women and Girls in Science. Last February, the Secretary General of the United Nations, Antonio Guterres, said, to rise to the challenges of the 21st century, we need to harness our full potential. That requires dismantling gender stereotypes. On this International Day of Women and Girls Science, let's pledge to end the gender imbalance in science. And with this spirit, I think we have to conduct this webinar. As all you know, the most important determinant of a country's competitiveness is its human capital and talent, the skills, education, and productivity of its workforce. Women account for 1/2 of the potential talent base throughout the world, but have been locked out of opportunities to participate equally in the technology sector due to various cultural, social, and institutional barriers. Engaging women in the technology sector is not only a moral imperative, it is smart economics. Gender diversity is good for business performance, which ultimately affects GDP. As such, over time, a country's competitiveness depends critically on the empowerment and the employment of its women. The underrepresentation of women in science has consequences for development, as all you know, but it has also consequences for research. As an example, in the area of infectious diseases, the lack of women scientists leads to severe gaps in diverse perspectives that are essential to addressing gender dimensions and the burden of infectious diseases, which often disproportionately affect women. For this reason, the focus of a series of webinars is particularly on African women COVID-19 frontline responders and their contribution in different science, technology, engineering, and mathematics sectors. This series of webinars seek to contribute to the body of knowledge available on COVID-19 from Africa by highlighting the contribution of African women in STEM and knowledge generated from their experiences. It also offers a platform to explore how further support can be given during this period. These webinars are part of a United Nations Office for South-South Cooperation Africa and AUC Department of Human Resources, Science and Technology Initiative in support of women in STEM in Africa, and are co-organized by the two institutions with the support of other partners. This high-level webinar, co-organized by the African Union Commission, is one in a series of 7 and a first global activity of the African Women in STEM initiative that the African Union Commission Department of Human Resources, Science and Technology and the United Nations Office for South-South Cooperation launched in 2018. This high-level webinar has 3 key objectives. First, take stock of some of the amazing work and contribution that African women in STEM on the continent and in the diaspora are making in the fight against COVID-19 and beyond. Build a consensus around the role of the African woman in STEM platform, the integrated digital platform that the African Union Commission and the United Nations family are finalizing, inspire and create a momentum for collaboration in view of solving African problems by Africans. Distinguished panelists, presenters, and participants together, we will overcome today and tomorrow challenges that Africa is facing. May this high-level webinar be the first in a series to give the floor to silent majority of practitioners, shakers, and movers. Thank you all.
Thank you very much, as a director, for those opening remarks. My name is Estherine Fortabon. I am the moderator of this very important webinar. I really want to call it a very high-level meeting to emphasize the importance of the topic, which is currently organized by the AUC and the UN Office for South-South Cooperation. Thank you to the chairperson, the deputy chairperson of the African Union, whom we have with us, who, despite his very busy schedule, has taken the time to grace this occasion and to give us the opening remarks. But before calling to the DCP for his statement, I will also want to appreciate the presence of the Minister, Dambili, the Commissioner, Her Excellency Sarah Agwo, and all the various presenters and participants who are taking part in this webinar. Without further ado, let me then take this opportunity to welcome His Excellency Ambassador Kwesi Thomas Kwesi, the Deputy Chairperson of the African Union Commission, to give us his keynote remarks. Your Excellency, my dear brother, you have the floor.
Thank you, Madam Estherine. Thank you all. Greetings to all distinguished participants. Honorable Stella Ndabeni Abrahams, Distinguished Minister of Communications and Digital Technologies of South Africa. My sister, Professor Sarah Agwo, Commissioner for Human Resources, Science and Technology. Dr. Ahuna, UNDP Rep. Ambassador Abdelatif, Director of UN Office on South-South Cooperation. All participants acknowledged. Can I, on behalf of the Chairperson of the African Union Commission, tell you how honored and humbled I am to be able to participate with you in this high-level webinar on African women, STEM, and their contribution to the fight against COVID-19. This is a matter of critical importance to Africa. For the past 8 months, as you know, COVID-19 has imposed on all of us a certain discipline. Our work and lifestyle has changed. The new normal is virtual. Webinars and online learning have taught us new ways to go about our business. The response of this pandemic in Africa has been swift. Many of our heroes, our ladies, scientists, they've gone unnoticed. It's important that we recognize, appreciate, and reward them. For us in Africa, 80% of our medical staff at the front line are women. I have a personal interest in this. My twin daughters, both medical doctors trained in Cuba, are in the front line in Ghana in the fight against Webna. In our various laboratories and our universities, our women researchers are working hard to find the best combination to treat COVID-19 patients. They deserve recognition, they deserve admiration, they deserve acknowledgement, as well as our love and appreciation. This is the best tribute we can offer our women. The African Union, as a commission, is very proud to announce at this seminar that this is just the first step in our contribution to promoting and supporting our women in STEM. Indeed, in the next few months, The African Union Commission, UNDP, will launch the African Wisdom Platform. That is an integrated platform to help women in STEM to share knowledge, to collaborate, to create synergies, and to inspire a new generation, to facilitate our networking between African researchers, to educate and mentor our young generations to do business in the new normal. As we do this, it's important to underline the African continent, our dear Africa, continues to face a severe shortage of health workers due to a lot of them immigrating and leaving the continent. I am told that in the year 2000, about 65,000 African women-born physicians, African-born physicians, and 70,000 nurses were working overseas. A census by OECD in 2007 revealed that Africa had the highest percentage of migrating women with a tertiary education. These are valuable material which we cannot afford to lose. This highlights the need for us to pay attention to their maintenance and their education. Both the AU Agenda 2063 and the United Nations Sustainable Development Goals recognize the need to urgently address global health and gender equality. Our policies should provide a conducive environment to boost the participation of our women and our ladies in development and economic management and to mainstream them. We ought to and we should deliberately focus on women's health, women's services, healthcare delivery, and improvement of the general social conditions of our women. In science, technology, and innovation, our women are still underrepresented, yet their potential is so great that we need to let them flower. There's a need for us to increase the diversity of our scientific perspectives on the gender dimensions and to bring more of our young ladies in science, technology, and innovation. My sister and dear colleague, Commissioner Sarah Agbo, and our United Nations partners are working actively on this and mobilizing every single energy within on the continent and the diaspora as well as private partners to finance the African Wisdom Platform. So after having the privilege of participating in this very important webinar with you, I can only wish you fruitful deliberations. I'd like to thank you all for the privilege of having joined you. Thank you for your kind attention. Thank you.
Thank you very much, Your Excellency, DCP, for those very, very important remarks of recognizing women in STEM and the important role in scientific leadership and in contributing to the Africans' advancement and transformation as defined in Agenda 2063. Your Excellency, you have also highlighted the underrepresentation and in platforms and policy arena of women in STEM, and the need therefore to establish this platform that will enable women participating in STEM to communicate with each other, to share their experiences, and contribute to the general advancement of knowledge. And therefore, the importance of the African Wisdom Initiative and the African Wisdom Platform that has been established through the collaboration of the UN South-South Cooperation Office and the Commission through our dear sisters, Commissioner Sarah Agbo, Her Excellency. So I want to thank you so much for those remarks. And I will take this opportunity now, as we had not done so before, to just present the agenda as it is. So we recognize the different sections and different speakers, and then we take it forward from there. So I think we have now listened to the introductory remarks from Mr. Abdel Latif, the acting director of UN Office for South-South Cooperation, and we just listened to the keynote speech of His Excellency Ambassador Kwesi, the Deputy Chairperson of the Commission. The following sessions, the next session will be a presentation by African women in STEM, and we have quite I'm very, very happy and pleased, you know, with the quality and caliber of women who will be speaking to us. And after that, we will have special contributions from UN Women. Then we will also have a special contribution from the senior representative from the Intel Corporation. After those presentations, we will have our panel of very, very high level representative, including the Honorable Stella Ndembele Abrahams, the Minister of Communication and Digital Technology of South Africa, Her Excellency Professor Sarah Agwo, as I mentioned earlier, the Commissioner, the Department of Human Resources and Science and Technology. And then we will have Mr. Abdullah Atif again in this panel. After the remarks from the panelists, we will have question and answers from participants, and then we will have a response, and later on a vote of thanks with some closing remarks. So without further ado, I will want to welcome the presenters and request Mrs. Simbogile Mungandi to make a presentation. But before we go that, each panel presenter has 5 minutes. And because we have quite a few speakers and we will want to hear from everyone, or plead with your indulgence that we stick on time. And we will be reminding you of the time slot. So when you have about 4 minutes, we will show you a white sheet of paper. And then when you have used your 5 minutes, we will show you a red card so that we can stop, you could stop speaking and we get to the next presenter. So without further ado, can I please request Mrs. Sibogile to make her presentation? Thank you. Do we have Mrs. Sibogile online? Do we have Mrs. Sibogile online? Okay, maybe we can go to the next speaker, the next presenter, while we find out whether we have our sister there. So let me invite Dr. Mugemba Sandrine to make her presentation.
Hello, everybody. Thank you so much for inviting me to attend this high-level webinar. I see there's a presentation on the screen now. Do you want me to move forward or?
Thank you. Well, can Mrs. Sibogile just indicate if she's with us and she's ready to make her presentation? It looks like she's on mute. It looks like she's on mute. Can the colleagues help us? Cynthia, can you help us get her on mute herself?
Yeah, let me message her.
Okay. Thank you, Sandrine, for your understanding. Thank you.
No problem.
Okay.
Technical difficulty, it happens all the time.
Yes. Thank you. Okay. So I think we can move ahead if we're not getting her, so that we
can move ahead.
Yes, I think we can. Okay. Dr. Mubenga, please, you have the floor. Thank you.
Once again, thank you for inviting me to this high-level webinar. And I commend you for putting together the WISTEM initiative and the platform, which is long overdue. So thank you for this wonderful event. So without any further ado, I'm going to speak about what we have done in response to COVID-19 when it hit the Democratic Republic of the Congo, where I am from. I'm going to share some slides. I'm the founder and president of the STEM DRC initiative, which is a nonprofit organization. We started back in 2018 and we've impacted about 6,000 people today. And we gave out about 60 scholarships in order to promote STEM in the DRC, in the US, and in the diaspora. So let me share my screen with you on this journey about COVID-19 and the actions we undertook. So please, I'm sharing my screen. Let me know if you see it. Do you see it?
Yes, yes, we do see it.
Yes, we do.
Great, perfect. Okay, so the first thing that hit us when COVID happened in the Congo is that we have about 85 million of people in the Congo. And I learned that we only had 1,200 ventilators available for 85 million people. So when I found that, that information, I launched, I initiated an action. You know, I went to Twitter. I'm a big, I use Twitter a lot, and I contacted, I called people to action, people from all walks of life, institutions, students, and asked that together we build an emergency ventilators that was made in the DRC by people from the DRC with whatever material we could find in the DRC. So that was the project that we did in response to COVID-19. It was to build an emergency ventilator made in DRC. So what you see on the screen here is the website associated with the project. We have built a proof of concept prototype that is fully functional. So that's the first step. Every time you develop a technology, after the proof of concept prototype, we are now moving into the pilot prototype, which is the prototype that is used for mass manufacturing. And we are close to finalizing the pilot prototype. And this journey was very interesting because it was a collaboration between many institutions. So it started from the STEM DRC initiative, my nonprofit organization. And we work with the University of Loyola in Congo, which is a Jesuit university. We also work, and that is where the lab is located. And we have students from the University of Loyola working on the ventilator. We also have a different partner that you can see on the screen here. We have the Denise Nyakeru Tshisekedi Foundation, which is the foundation from the First Lady of the Congo. INPP is the National Institute for Professional Preparation. We are also working with the Biemba Marie Mutombo Hospital, which is the hospital that was built by Mutombo Dikembe, an NBA All-Star who hails from the Congo. We are working with EcomSAS, which is a company that has, it's a telecommunication company that has offices in the Congo and in France. And we have partners from the Xavier University of Louisiana in the USA. Myself, I'm an assistant professor at the University of Toledo in Ohio. So what you can see here, you can see students from the University of Loyola working on building the prototype. And what I want to share with you is that those students, some of them are members of the STEM DRC initiative, and we were very pleased because some of them received our scholarship, the first scholarship we gave out. So it was such a blessing to see the seed that we planted 2 years ago actually come to fruition by having those students using the knowledge they have in STEM to build a solution against COVID. So what you can see here at the bottom, that was an animation, but because of time, I'm not going to show it. But the ventilator basically consists of having a mechanical part that is pressuring a balloon. That blue balloon here that you see in the middle provides air to the patient so that they can breathe, because one of the difficulties with COVID is it affects the respiratory system. So you have this mechanical part that pressurizes the balloon to provide air to the patient. And everything has to be controlled based on the parameters from the patient. For instance, the breathing per minute, and there are so many, the volume, and so many things that have to be calibrated. So the picture that you see here are the main three parts of the ventilator. We have, number one is what we call the clinical part. Number two is the brain of the machine, which is basically the electronic part. And number three is the mechanical part. And at the bottom here, you can see pictures of students when we were having a robotic workshop by STEM DRC in Kinshasa. So we were teaching girls from they were between the age of 12 and 18 on how to build robots. They built those robots, they programmed them and tested them. So those are the kind of activities that we do in STEM DRC initiative in order to promote STEM, STEM research, education, and entrepreneurship. So in addition to that initiative with STEM DRC initiative in building the respirator RDC, I am also part of an organization called Bukavu for Bukavu. And this organization started in June 2020, and it was initiated by Dr. Pascal Sanginga, who is also from the DRC, and he's currently working at the FAO in Abidjan. But since June, basically these are the actions, accomplishments that have been made. We have Bukavu for Bukavu has over 1,200 members. They have raised $32,000 and they have provided PPE equipment to 8 health centers in the Congo. They gave out 15,500 masks and provided internet access to 15,000 students. So those are some of the actions made during COVID. They also built many hand washing stations that they provided to schools, and those hand washing stations impacted approximately 11,000 students in the Eastern Congo. So I think my time is up, and I thank you for listening.
Thank you so much. Thank you so much, Sandrine, for that presentation. Very inspiring. Very inspiring. A few things are standing out for me, like local manufacturing. I think the COVID environment has shown that these global supply chains can be problematic. And so we need to see how we start doing this type of manufacturing in our own countries. And you have proven that it can be done. Partnership is standing out quite as an important element, working with different institutions to bring the knowledge and the experience to be able to do that manufacturing in Congo. And this is an opportunity for these young ones to learn the science, and they give them the kind of curriculum that would be necessary for our countries to transform in the 21st century. So robotics, these are the things that we need to see our schools teaching our young people. And of course, entrepreneurship, because when we design these things, we want to have them for business opportunities as well. So thank you so much for that presentation. I think we will be picking up on these points that are coming out from the presentation. Let me now call on Mrs. Sibordile, if she's ready now to host her presentation. If she's ready.
Ms. Farabong, she's having issues with her connection, so we can leave her for last.
Okay, all right. So we can call on Dr. Shiko Gitau to make her presentation.
Thank you, everyone. I'm just about to share my presentation. Please let me know when you see it. Are you able to see it?
It's a
Not
blank
yet.
screen.
Not yet.
Are you able to see it now?
Not yet.
No,
Okay.
we still have
And
a
now?
green screen. Not yet. Not yet.
All right. Now it shows from my end, it's shared. Can you see it?
No. Not seeing that. Not yet. No.
Now?
Not yet. It's still a blank screen.
Dr. Gitau, if you can try sharing, go back, click on the share screen, and within the share screen, you will see multiple options, multiple screen. Click on the one with your PowerPoint presentation, because right now you are clicking on the whiteboard. There you go, you got it.
Yeah, we can see it now.
Okay,
Yeah.
awesome. Okay, cool. Sorry about that. Good afternoon, good morning, good evening. I know we are from different parts of the world. My name is Dr. Shiko Gitau. I'm doing this actually from the village in Kenya because we have internet here. We ran away from Nairobi because it was becoming a bit hectic. I want to present about our work that we have done around COVID. And I titled my presentation Evidence-Based Interventions, because there have been a lot of interventions, but what we have been very clear about as a team and as an organization is to be able to provide evidence-based organization. And we do this primarily using data, but the word data-driven in decision-making has been overused. And so, but the goal about data-driven decision-making is around having evidence to make an intervention or to make a decision. Oh, for some reason, okay, there. So, so who we are. So just a quick presentation on who we are. So color is actually a South African word. It's a Zulu word, ngala, and it means to ignite, to spark. And we are a Digital Innovation Lab headquartered in Nairobi, and our goal is to support organizations and governments to take advantage of data and in the digital evolution. And when we think about COVID, it was a three-pronged, it was a multi-pronged crisis, and we focused on three of those areas. We focused on health, economic, and social crisis. And for us, it was very important to use what we know best. We are technologists. I'm a computer scientist, and I'm a very, very proud STEMmer. And it was important for us to be able to say, this is what technology and digital can actually contribute in building an intervention for COVID. And we started with health. I remember it was, COVID was announced on 12th of March in Kenya, and everybody was like numb because offices were closed. The president called upon all companies not to allow their staff to go to work. And we were just in the office, just brainstorming on what can we do as a team to help in this crisis, because we cannot just sit and on our feet and wait for it to go away. And realize, we looked at what are other people, like what is Singapore doing? What has China been doing? And we realized very early on that data is a very important thing. So we started doing very simple things. We did modeling, and it was not like fancy, like epidemiological modeling at that point. It was like helping counties understand if COVID was to hit all of Kenya, what is their comorbidity? I mean, what is their mortality risk? And we did this. We took all the comorbidities. We took HIV as a unique comorbidity for Africa, and then we took diabetes, hypertension, we took TB and other respiratory diseases. And this is data that already exists in the ministry, and layering all of this and adding age, we're able to map out what would Kenya look like if all the 47 million Kenyans got COVID, which are the counties that are most likely to have the highest mortality. So that which means that, oh, okay, these are the places that we need to first send intervention fast. And when we presented that fast information to government and through the ministry, we realized that this is information that has not been done. Like, clearly it was too early in the crisis in Kenya for people to have thought through this. And we actually did this very fast within the first 5 days and presented it. But it presented an opportunity to look at what does a health crisis look like? When we mute COVID, what does a health crisis look like? When we say, okay, all resources are being driven towards COVID, what happens to these other health indicators and health problems in the country? And started digging in and saying, let's try track what's happening in the country. And there are many things. We have like maybe 30 indicators that we've been tracking over the past few months. But I want to present that two that are very specific to women. One of them is, okay, so we find opportunity. I already spoke about this. So we became the health expertise for the government. And I remember the president one day when he did not want to open up the country, he said, according to the experts, we do not want to open the country. And on Twitter and on Facebook, there was this picture that was going on around, people saying we want to talk to those experts, but it was a very data driven, and I was very proud of the country. I'm still because they used our data and to be able to inform their decision making. It was a very proud moment when the president said, according to our experts, we cannot open up the country at this point. So I was going to go into, this is how we did it. We analyzed health data from DHIS. So DHIS is a health information system database that is in most countries. And then we design data catalogs to look at health indicators, very specific, that are going to, if anything happens to them, the country is going to have a health crisis. And then we build data platforms and visualizations to help the country actually cope with this. And some of the visualizations are these. So gender-based violence is one of those things that have been spoken globally, having increased because of COVID. And we started saying, how does Kenya compare? And we said, we're not just going to look at 2020 because it's a unique year. What does 2020 compare to 2019 and 2018? So we have markers. So we said from July of 2020, what happens when you go back 2 years back? And this is an actual visualization. As you can see, the designers did it to scale. So in July 2020, it was okay. And then this is end of July 2018, 2019, and 2020. So when you present this data to the police and to the Ministry of Health, there's been a lot of like action that has been taken, because they're saying, this is our data. These are women who are coming to the health facilities, not even the police. These are the women who are going to health facilities to get medical help. So these are the reported cases. And we all know that when it comes to gender-based violence, only a fraction of the cases are actually reported. When you show this number, and it's almost 50% increase in gender-based violence compared to last year, then it's time for somebody to take some action. And this is the kind of information we've been giving and feeding to the ministry and to the National Task Force on COVID response, and saying these are actions that you need to take. Let's not focus too much on COVID. Let's look at what other health crises that are happening. And this is a huge one. The other interesting one, there's been a huge debate around teenage pregnancy. So there's been like all sorts of media coverage around teenage pregnancy around the country. And we sought to understand, is there really teenage pregnancy crisis in Kenya? Like, how does this compare to the last 3 years? And again, we go back to, did it really increase? Did COVID make more young women exposed to pregnancy? And the answer is actually no. And when we talked to medical, I'm going to come to that. When you talk to medical practitioners, they tell you, in fact, most pregnancies happen, an increase in pregnancy in Kenya happens between December and January. And any indication of a COVID-related pregnancy will be felt between August and September, because that's the first trimester of the pregnancy that many of them will feel it. And for us, this was one of those information is saying the media is telling us this, it's feeding us this, it's feeding the population this, but this is what the data is telling us, that the number of pregnancies that have been reported at medical centers, actually there's a 15% decrease compared to the last year. So this is a kind of nuggets. I wanted to just take like very gender specific data to show you how we have been actually feeding this. So that is in terms of health, health indicators. And out of all of this, we partnered with the University of Nairobi and the Ministry of Health to form what is now known as the Center of Epidemiological Modeling and Analysis. And if you go to SEMA.Africa and you go to Kenya Health Data Trends, you can play around with data. You can find out anything from malaria to teenage pregnancy to immunization, which was another big thing that was being spoken about. How is immunization happening in the last 6 months? So you can go and play around with it. And it's a data platform that we have built for anybody anywhere in the world to be able to interact with health data and make sure that decision making is being made based on actual data, not fallacy, as we've seen in those 2 cases that I have just presented. The other big one we were solving for is economic. And our big goal was to support MSMEs. We all know that MSMEs are the backbone of any country in Africa. And during COVID, many of them died. And they didn't die because of anything major. It was because of they just were not able to survive a close down of the country. So what we've been doing is solving for them by saying, what do you need? You need financing, you need mentorship, you need connection to your supply chain. And we've been solving this using a B2B platform that we are calling Jukua. It was built during this crisis, and it was built to not only solve for COVID, but to see how do we create resiliency in when everybody's moving online using technology. And our third intervention has been around social and intervention. We know many people lost jobs. Yeah, many people lost jobs, especially in the informal and gig economy. People were not just paying enough. And the saddest thing, when we did our research, we realized that many people did not have social protection mechanism at all. No insurance, no savings, nothing. In fact, when we did this research very early on in April, May, many Kenyans, only 6% of Kenyans had savings to last them for 3 months. Yeah, and we are 7 months into the crisis. Can you imagine? Many people have dropped into poverty, have moved back to the village, don't have a job. But there's an alternative to a career, and that's the gig economy, when people are using the internet to find jobs. Also, they don't have social protection mechanisms. So what we have been working with some partners on is how do you build a social protection mechanism that allows—
Sorry, Dr. Gitao, I know you are in the flow of things, but please, if you can wrap
1
up.
minute. This is my last slide, actually. So what we're doing is building this social protection mechanism, and we're partnering with the Ministry of ICT to be able to approach young people across the country and encouraging them to save and take a health insurance, and to take like an education cover for their children, to be able to solidify their social protection. Even if a crisis happens again, we are all protected. And thank you very much. Those are my contact details, and thank you so much for this. I know it was fast. If you have any questions, you can contact me directly. Thank you so much.
Thank you very much. Thank you. Very interesting presentation. And I'm really sorry that we have to stop short. There's so much to share, but we want to give the opportunity for everyone to make a contribution. But really interesting, all the work you're doing and the importance of evidence-based decision making. I think more and more, and from this COVID, it's been shown that we really need to move towards this direction, and building skills in modeling for our young people is critical. Let me invite Dr. Linda Mubula to make her presentation.
Hey, good morning, good afternoon, everybody. I will be the second presenter speaking about DRC, and it's a pleasure to be here. It's really an honor to be with such great panelists. I was working in DRC on the 10th Ebola outbreak in March of 2020. And on the 10th of March, the first COVID-19 case was reported in DRC. It was an imported case from France. And I was tasked to assist the government of DRC to write the national strategy for Ebola, for COVID-19, based on lessons learned from Ebola. So what did we learn from Ebola? We learned that it's important to have a community-based strategy that uses existing infrastructure, such as contact tracers, surveillance, but to also rely on your leaders because they actually allow you to have trust with your community. And like Ebola, COVID-19 is an emerging infectious disease. And so it's important to have evidence-based strategies. But with COVID-19, as you all know, there is very limited evidence in terms of clinical management. There is not a vaccine. And so that poses multiple challenges. So with COVID-19, we put into place a national strategy very early on in March in DRC, working closely with multiple partners, UN, NGOs, governments, and bilateral and multilateral donors. And we utilized the same infrastructure that was utilized for Ebola. There was an incident management system that was put into place. What is the lesson learned from that? You need strong leadership and coordination to coordinate your partners well. It's important to have clear guidelines and clinical protocols, and that was a challenge, obviously, because of the lack of guidelines and protocols. But the case management or clinical management team that I was working with put into place a protocol that was adapted to the DRC context, utilizing WHO guidelines. It's important that your response be localized, that you utilize local responders that understand the context well. And I think that was one of the successes of this response, was a localized response that utilized community leaders and religious leaders, but also utilized existing infrastructure, both community-based, but also interventions such as contact tracing and surveillance. I then deployed to New York City in the month of April, where I worked as a clinician. I'm an assistant professor of medicine at Johns Hopkins and provided clinical care to COVID-19 patients. And this was at the height of the outbreak in New York City. And that proved to be a challenging response as well for many reasons. Again, the lack of clear clinical guidelines. I think as a clinician, we like to empathize with our patients, and having personal protective equipment that's extremely safe, and to understand that you're there for them. But there are methods that clearly communicate with your patients as well. And it was very interesting to understand the principles of emergency management that I had learned from working on Ebola in DRC and West Africa that were utilized and applied to the context in New York City. As you know, the outbreak has affected people of low socioeconomic background, but also ethnic minorities and immigrants. And I think I had a patient from Ghana who told me that he was very happy that I was his physician because I could understand him better. So I think it's very important to have diversity in medicine, in public health, as well as in STEM, so that we have good representation, a good understanding of various interventions from a scientific standpoint, that these interventions are applied, that they are rooted within a better understanding of the context. And I will stop there. Thank you.
Thank you so much, Dr. Mubula, for sharing that experience. And I think what really stands out for me is what you mentioned about having localized response. So using the global frameworks and directives coming from WHO, but really localizing it and putting it in the context in which you're operating. That's one, and actually using the experience from Ebola, from Africa, being relevant to sort cases in New York, which is working well. So you can also see the reverse flow of information from, well, so-called less developed or African countries to so-called developed world. So I thank you so much for sharing that with us. Thank you. Let me invite now Dr. Linda Bello for her presentation.
Hi, good morning, good afternoon. I'm Dr. Linda Bello. I'm in London currently. I'm the chairperson of CamDoc UK. I'm also a family physician working in London. I've been working in London in an inner city practice as a general practitioner throughout the pandemic. My job involves looking after the patient holistically, managing both acute and chronic conditions, prevention of disease, emotional support, etc. In my practice, we've been looking to change our way of working by embracing the new technology. At the peak of the pandemic, during our lockdown, most of our consultations were via video or by e-consultations. We had to adapt our guidelines to managing conditions over the phone. And all in all, this worked very well. The challenges we faced were with elderly patients who didn't have the technology required, or even when we offered them an appointment to come to see us in the surgery, were very afraid to come in to be seen physically. They thought that they would get COVID. My other role, which I mentioned earlier on, is as the chairperson of CamDoc UK. This is an association of medical doctors and dentists of Cameroonian origin working in the UK. And our aims are to promote and preserve health and the well-being of the general public, in particular, but not limited to the Cameroonians that live in the UK, to promote and preserve good health for the public benefit in particularly, but not exclusively, by developing good healthcare in Cameroon. So when the pandemic started, we immediately started thinking of ways to help our colleagues back home in Cameroon. And with shortages of PPE occurring in the UK, we knew that Cameroon would have similar, if not worse, shortages. To this effect, in April this year, we launched a fundraising appeal to raise funds to help procure PPE for our colleagues in Cameroon. So normally we would fundraise by our annual gala, which we normally have in June or July, but unfortunately was cancelled this year, so we had to think outside the box. So the first thing we did was to release a solidarity video for our colleagues in Cameroon. This was aired on CRTV, which is one of the main television networks in Cameroon. We did get quite a good response to that as well. We then made a fundraising video, which we shared with all our networks here. And I'm very pleased to say that we were able to raise £24,000 so far. With these funds, we've been able to procure some personal protective equipment from China. So we bought 1,200 face shields, 13,000 masks, 10,000 gloves, 100 liters of hand sanitizers. And we are hoping, and we've actually already started delivering this to hospitals in Cameroon. We're hoping to reach 10 hospitals in each region. So, we are sort of nearly halfway there as we speak. So we're quite proud of that, and we've got some really good videos and feedback from our colleagues who feel that we've really supported them during this time. Pre the pandemic, we would also be hold screening and educational events open to the public, face-to-face, but obviously during the pandemic, we had to find new ways of working. And we did this by the use of webinars, such as these ones that we're attending now, conferencing facilities for our regular meetings. So in June this year, we started some monthly webinars, which we entitled CamDoc UK, Talking with the Community. The topics were chosen by the public, so we sent them a Google form, we sent them to all of our organizations that we were linked with, and we gave them, and in these webinars, we give them the opportunity to answer questions which are answered by the panelists. So our first webinar, for example, was in June, and we discussed all things COVID, covering several aspects from managing symptoms at home, what to do to boost your immunity. We also had a follow-up webinar where we discussed traditional and African remedies. We spoke about the drug trials, COVID vaccines. Our sixth series is in fact this Saturday, where some of our colleagues who have had COVID will be talking about their experiences of COVID. So that will be a good one to attend. But most importantly, we have continued our education. So we've created several short educational videos, which are available on our social media platforms. We're on Instagram, Twitter, and our YouTube pages. We have a website, camdocuk.org. On that website, we have a question and answer button where we encourage members of our community to ask any health questions they have. They don't only have to be about COVID, because our organization is made up of lots of different doctors from different specialties. I think it is safe to say that we have truly embraced this new way of working, and we're happy to report that so far we've only received positive feedback. So I'd like to thank you so much for inviting me to a webinar like this, which really goes a long way to highlight our efforts and also gives us the opportunity to share ideas and to learn from one another. Many thanks.
Thank you so much, Dr. Bello, for really using the social media platforms to educate, share information, and raise awareness, as well as providing those PPEs to communities that are so desperately needed for them. So thank you so much. Please let me just remind all participants to send your question through the chat window so that we can collect all of them and don't leave any question unanswered. So we will try, because of the time factor, to respond to all questions, but if not, these questions will be documented and will be responded to in the next webinar in this series. Thank you very much. Thank you, Linda, for really that sharing that experience with us. Let me now invite Dr. Augustina Silverton to make a presentation.
Thank you very much for inviting me to this webinar. My name is Dr. Augustina Angelina Silverton. I teach at the Kwame Nkrumah University of Science and Technology. I'm interested in viruses. I actually teach microbiology. And apart from that, I also conduct research at the Kumasi Center for Collaborative Research in Tropical Medicine. And just by way of another introduction, I'm also a founding member of an exciting group we have called WITSTEM, so Women in Science, Technology, Engineering, and Mathematics, on the campus of KNUST. So indeed, we are still in the pandemic, and I actually lead and coordinate the testing at the second largest testing site in Ghana as far as COVID-19 is concerned. I think I had to brace myself to take up this task because of my previous involvement with research relating to coronaviruses. And I think I built on those experiences. And so when Ghana had the very first few cases, we were ready. We collaborated with some foreign partners, and we made sure that we had all the testing systems and the structures, as well as building the capacities of our young laboratory scientists to enable us a readiness test for the presence or absence of this virus. And so we're so very much excited when the president of Ghana visited our institution for the first time in history. And I think what has really worked for me during this pandemic is about the fact that I have some previous experience with coronavirus work. I mean, spanning from SARS coronavirus, MERS coronavirus, and the current SARS coronavirus 2 pandemic. My PhD was focused on coronaviruses. So I think, like I said, I was really ready and braced myself up. So apart from leading and coordinating the team, I also had to build some laboratories from scratch, and again, build the competencies of laboratory scientists to enable them test for either the presence of the virus or the absence of this particular virus. And again, I was also engaged with the media. And there were instances where I had to again brace myself up as a woman and sit in front of the TV screens with high-level ministers. And of course, as a scientist, I had to make sure that my opinions, especially related to my background in virology, was clearly spelled out. I had a lot of challenges. Maybe challenge number one had to do with the rate at which samples were coming in. Even though we had some experiences with coronaviruses, we still had challenges because, of course, this one is a pandemic. And I keep on saying that I have not seen a pandemic before. And so some of the issues we had to just do a knee-jerk approach or apply a knee-jerk approach, but gradually we braced ourselves up. And we are very happy that at a point in time, the president of the country appreciated our efforts. And again, when it comes to the media engagement, I think I also had some experiences and also built my skills from a number of fellowships I engaged myself in. I think that it is, we still end up educating the general public as far as COVID-19 is concerned. Thank you very much.
Thank you so much, Dr. Stevenson, for that amazing work that you're doing, being in the forefront of the fight of COVID-19. Thank you so much. We've come to the end of our first segment, listening to the presenters. And I think you all agree with me that we've had amazing stories from all 6 presenters, and we'll have time to engage with them later. But I really want to congratulate them for the excellent work they are all doing. Let me now invite, we're now in the session on segment on special contributions. And I would like to invite the UN Women representative in the AU to make her presentation or statement. Thank you. Do we have the representative of UN Women with us?
That will be Mrs. Marie Goretti. Could unmute yourself, please?
We can see you, but we cannot hear you.
Is she unmuting? Should we take the representative from Intel Corporation while we wait for UN Women to get ready? Rav, can I invite the representative from Intel Corporation?
Mrs. Fatabong, may I suggest that we get the presentation from Sibongile? She's ready. as the two special contributions start.
Okay, all right, very good. Thank you. So please, Sibongile, Mrs. Sibongile, please can we're ready to hear from you. Thank you.
Greetings all. Hello, can you hear me?
Yes, we can hear you. Thank you. We can hear you.
Okay, greetings all. I go by the name of Sibongile Mungadi. I'm originally from South Africa, and the organization that I'm actually presenting is called Ukuhamba. Ukuhamba basically is an African word meaning mobility in English. So what does Ukuhamba do? We actually produce your low cost, meaning your cost effective, lightweight prosthetic to improve the condition of amputees living with disabilities, thus giving them back their independence. That's who I am, that's what I do full time. So the fact that we were actually, we were actually attacked by this uncertainty times for most of us and to everyone, which was the times of your COVID-19. So what happened was I had to redirect all my company's focus to try and play my part in coming up with solutions that can actually help my country. So what I actually did was, first I was actually called by UNDP South Africa as one of the makers and innovators to actually come and be an enabler, bring solution on board. So as you can see some of other pictures, I was actually called to design your autonomous infrared contacted lens sensor temperature, meaning that we were tasked to actually design a contacted lens sense temperature that no one should monitor it or there shouldn't be any physical contact. So this was actually built in a period of a week. That's why I used my skills of 3D printing. And this was actually built through the key components such as your MLX sensor and also your PC board, jumpers, your Arduino board, which the software that we actually used it was Nano, and also your solder wires and data cable. And then this, as you can see on the last picture, that's where I'm standing behind. So this was actually to make this contacted lens temperature to be more interactive, user-friendly. So as much as you approach closer to it, it actually guides you. It tells you, come closer. As you come closer, and as you scan your body temperatures, it gives you your body temperature there on the screen, meaning it displayed on the screen. And we actually had to integrate this with the sanitizer. So meaning what it does, so this was actually built through your technology such as your 3D printer and laser cutting. So what it does, you first has to sanitize yourself and using sensors, and then it also do your body temperature. So this was built in a period of a week. And moving right along, what I also managed to do, playing my part in my country, as you can see the pictures below, I was actually producing your 3D printed mask, your PPE. And this, I actually did this out of love. And there was any funds donated to this. So meaning this was an initiative that I actually started. So I was able to produce more than 200 of these, and these were actually donated to our local hospitals, such as your Parapane, your Deratong Hospital, for our frontline workers to actually help in fight the spread of COVID-19, as you can see. And these are some of the face shields. It was actually designed through using your laser cutter. And also, moving forward on that, I'm actually still working on a cost-effective 3D printed and also laser cutting ventilator that would be used in my country, as that is actually designed on an open source platform. So that's how I was actually being able to actually play my part And also a huge thank you to Innovation Hub. These are some of the organizations that came in part and played their part so that I was able to purchase my own equipment. So these were like locally manufactured and produced at my own space. Thank you very much.
Thank you so much, Sibongile. We are so happy that we could hear this presentation. This is amazing work you're doing. Congratulations, and we look forward to perhaps engaging more with you and seeing what you're doing. Thank you so much.
It's a pleasure.
So perhaps let's listen to the UN Women representative if she's ready. Is Mrs. Goroti ready for her presentation?
If we are not able to get Mrs. Goretti for now, we can have Susan Bogo from Intel Corporation.
Okay. So, yeah, Susan, please, you have the floor if you're ready.
Yes, I am. Thank you. I've turned on my video.
Ask Sibongile to remove the presentation from the screen, if that's possible. Good.
Okay.
Thank you. Thank you. Susan, please go ahead. Thank you.
Thank you very much. So mine is not a presentation. It's more of a statement based on observations in my current role. So I manage Intel business in Eastern Africa, and working in a multifaceted technology company has given me the opportunity to interact with some extremely intelligent people, both in STEM and non-STEM roles. And unfortunately, a disturbing contradiction is that while globally the demand for engineering and technical skills is growing 3-4x, the participation of women in this area is either declining or stagnating, depending on where they're located. And this must change. It has to change. We need more women in STEM roles, and feeding that funnel. We need more girls taking up STEM subjects. And so, Intel is the world's largest manufacturer of semiconductors and is behind thousands of innovations that you use every day. And as an engineering company, we recognize the need to have more women in STEM. And in order to do that, we have launched and actively participate to individually as a company and also with partners, Dell, Microsoft, lots of multinationals across the world. And we participate in multiple initiatives to inspire women and young girls, to educate them, to equip them with the necessary knowledge and the skills and the dispositions as well to be successful in life and in STEM roles. We've implemented education programs with the governments we work with and rolled out mentorship programs for girls and young women. Listening to the innovators here today, I'm sure it would help to have access to the latest technology, and we've made resources publicly available to upskill innovators and matchmake them with vendors that will help them enhance their solutions. As you saw from Dr. Gitao's presentation, data platforms, if used properly, can literally change the direction of a country. I'm Kenyan as well, so the social media, picture she put up there, I'm familiar with KOT, that's Kenyans on Twitter. And so, it's a force, it's quite a force. And so having data to make decisions is what keeps us on the right track and enables us to actually make the right decisions for the country. Supporting women in STEM, it's a personal passion point, and I am grateful to be working in an organization that prioritizes this as well. I know firsthand from working in a technology environment that the challenge faced by women in STEM roles is not just one of education and access, but that's just the beginning. Having the knowledge, it's just, it's what gets you there. But once you're there, you face a completely different set of challenges. You're judged by your gender, even before you open your mouth. You're seen as a woman first and then a professional. And I'm pretty sure some of the women who presented earlier can attest to that. You deal with very traditional mindsets that, these are the things that now we try to change. And when I talked about, supporting the women, not just education, but in dispositions, is to support them be able to handle the challenges that they will face, both from a technology perspective and a social perspective. So I am so encouraged and inspired by the presentations shared today, and I feel really privileged by the opportunity to contribute to the development of this initiative and of the platform. I'm eager to support wherever possible the innovators and the innovation. So thank you very much, and congratulations for setting this up, and I can't wait to see where it leads.
Thank you very much, Sarah and Susan, for those for that statement and those encouraging words that Intel is supporting and really ready to continue to support our innovators. And really, the point you raised that women in STEM is declining. We are actually noticing a decline in numbers in women in STEM is really concerning, and I think all hands have to come in on deck so that we have that changed. Thank you so much. Can we call on UN Women now for the presentation or their statement? Is UN Women ready? Cynthia, do you know if they are there?
Yeah,
ready?
it seems their connection is not working, so I think we can move on in the interest of time.
Okay, thank you so much. So we've listened to all the innovators, and we've listened from industry, to Susan, and now it's the opportunity for us. We're coming to the real high-level panel where we're going to get response and statements from our policymakers, both at the continental level, at the national level, and from the UN agency. So without further ado, let me very warmly welcome Honorable Stella Dambili Abrahams, the Minister of Communication and Digital Technology of the Republic of South Africa. Minister, you are very welcome, and we appreciate you being here. You have the floor.
Thank you so much, my dear sister, and greetings to all the fellow participants and panelists that we have today. Firstly, let me express my appreciation to the organizers, being the United Nations Office for South-South Cooperation, and of course, the African Union Commission's Department of Human Resources, Science and Technology, for inviting me to be part of this webinar as a panelist. Program Director, I would briefly share South Africa's response to COVID-19, as all of us never saw it coming. And indeed, when it hit us, it exposed us to the real challenges that we didn't even think that far about. Key to this was a need for all governments and citizens to come up with a coherent strategy first to say, how are we going to combat the negative impact of COVID? But most importantly, how do we make sure that we minimize the spread of COVID amongst our people? And I did mention earlier that at the center of all of this is to make sure that we give communication to our people. Because if as leadership of any country, you're gonna ask people to do certain things, especially when there's an outbreak of a disease, people get to panic. They don't know if they're not gonna lose their lives. They don't know if government hospitals are ready for them, including the private industry. And therefore, as the minister responsible for communications and digital technologies, ours was to make sure that firstly, we create an enabling environment for remote working. Secondly, we've got to make sure that through all the communication platforms that we have access to, our people are able to access information. Hence, in March, we therefore released the directives which afforded not only the industry to say, we do appreciate that the President has called for a lockdown. Everyone has to work from home, although we never anticipated that as government, we've been deploying broadband infrastructure to public buildings. We never anticipated that people one day will not be able to utilize those buildings, and therefore they will have to work from home. Same applies to the industry. They never anticipated that the quality of bandwidth that they've provided to the rural areas and actually homes may therefore one day be a challenge to people that must utilize the services, because as you are aware, most of them focus on the profit-driven areas, the suburbia, government buildings and all that. Therefore, the first thing was to say, through the regulator, we have to make sure that we avail our temporal spectrum so that we minimize that high impact of traffic in the work that is being done by the operators. So as we did this, we needed to make sure that we balance both the lives of our people and the livelihoods. At the same time, the state has to remain productive because people must still be able to have food. People must still be able to have access to educational healthcare services. And at the center of that was us making sure that as government, we establish the National Command Center that must therefore establish work streams to look into the different components that we deemed very necessary in order to combat the spread of COVID in our country. We have to look into the human rights issue, we have to look at the socio-economic impact, but most importantly, we have to look at that matters most, to say, how would we give an opportunity to all to showcase or come forward with whatever solutions that they have to make sure that we can defeat COVID-19 that has attacked us. When we imposed curfews across the country, people were panicking. We restricted physical attendance of learning at learning institutions, and we mobilized medical resources to support targeted responses across the country. We set up mobile hospitals with larger capacities in order to treat patients. We had to make funds available, including going to an extent of extending the social grants, which we supply to the needy in our country in order to take care of the indigenous communities and workers that are mostly affected by the reduced economic activity across the country. At the center of this was the information campaigns on preventative measures against infection that we launched nationwide. As evident from the measures that I've alluded to above, communication strategies and access to information by committees was essential in order to ensure the access of the first strategy of the national response to the COVID-19 pandemic. As a minister responsible for communications and digital technologies, again, I had to make sure that I harness and bring everybody in the sector in order to come and share with us what strategies and innovations that we can employ in order to create that remote working, but also promote good livelihoods. We established an ICT work stream wherein we invited all industry players to come and share, innovate, and key to that, as I said, we had to make sure that the state remains productive. Therefore, it meant that Parliament must still function as it needs to function. Committees, so that government can be able to take critical decisions, and at the same time, committees must also be functional. So one first thing that we did was to reach out to our industry. Please enable, give us access to remote working, allow Parliament to operate virtually, and it means certain laws had to be passed immediately or rules had to be changed just to accommodate that. We needed to make sure that we boost the economy, and one way of doing that, we established the Solidarity Fund. I mentioned earlier that we extended the social grants to those that are unemployed and needy. But on top of that, we also, with the Department of Social Development, we provided food parcels, which were not only provided by the state, because one great thing that South Africa has experienced in this COVID is that when we work together, we can do more. When we are able to coordinate our efforts, we're able to collaborate for effective execution. And that has been done very well. One of our agencies, the Postal Office at the South African Post Services, was responsible also for the distribution of grants countrywide. And people are sitting at home, Program Direct. That tells you there's going to be lots of fights. That tells you that people are going to be bored. We're going to see depression levels increasing. And in order to cap that, ours was to say, how do we then work with the Department of Arts and Culture that has a responsibility to entertain, amongst other things? And we worked with them because we had provided trainings to young people as part of building a capable fourth industrial revolution arm in South Africa, wherein we train people on digital content development, amongst others. And now working together with the arts and culture, we then had lots of young people who were creating content and availing it online. They were able to have some shows, and at least it minimized the impact of people who were just sitting watching the normal, as we also have seen through the broadcasting industries, that those that are responsible for the creative industries could not go because we have put everybody on lockdown. Now, if you're putting everybody on lockdown, it tells you that those companies that are production companies also have to stop working. We had to identify essential services and limit the numbers of people that could work and different areas that indeed were essential. So the emergence of this creative industry that occupied the digital platforms was something that we saw as an opportunity that gave people not only economic outcomes, but also it got to entertain and educate others. Key to this, of course, is ensuring that we establish the coronavirus online website, which was responsible to generate daily reports on diagnosis, recoveries and deaths in the country. And the platform provides our citizens with useful and practical information and support. Most people have been visiting the website and it's so effective. Medical practitioners were expected to report into this platform electronically. They shared their observations with the National Health Department. Information in turn was provided and was used to generate epidemiological curves for the whole country and for each province separately. We got data scientists that were then data analysts to assist in terms of mining the data and analyzing it in order to make sure that the response that we provide is real, but also can be responsive. And government was working with all its own components together with the private sector and the communities in order to say, South Africa, you can do it. And if you can do it, it means we've got to hold each other's hand. You play your part, I play my part in order to make sure that we remain safe. But what we never anticipated was the different ways in which the online platforms, for example, the text messaging, were used to report cases of gender-based violence. We did not see that. And as people are sitting at home, we saw an increased level to gender-based violence because now we had the operators that have zero-rated certain platforms. We had to report fake news wars that causes panic, amongst other things. And now as people get to report these violences, then it therefore said, government, now we've got to shift focus. You were only looking at COVID, but there is this emerging pandemic also that is of human error, if it's an error or it's human made, because I don't know what causes people to be violent. Maybe it's mistakes, it's how they grow up, or it's the way they react, but it tells you that it's something that cannot be acceptable. And through this, it really exposed once more our poor infrastructure. I've spoken about the interventions that we tried to introduce, and if you listen to me, most of them were technological based, and whether we're going to be talking about online streaming, whether we're talking about the services that the industry was rendering. But we had managed to make people to be digital outcasts, not out of their own making. And this, therefore, that put pressure in government and the private sector to say, we've been talking about connecting the unconnected. And COVID has really exposed us to these harsh realities that we're not treating our people equally. There are those that are still discriminated because of where they are. Therefore, as government, we've got to improve on how we then invest in digital infrastructure services so that our people can have access in the ecosystem. Because as much as we said zero rate, these other people didn't have smartphones. Other people struggled with network itself. Others could not even have the devices to access the virtual education that we try to intervene with. But as I said, this was a learning that helped us to say, now we see where we have failed, or we see where the next economy is driven. And therefore, as we talk about the economic reforms during the COVID period, key to that, government has agreed that at the center is provision of connectivity to all people of South Africa. I must say, colleagues and beautiful women, that as a country, we were resilient in fighting the spread of the virus. Up to date, we have about 90% recovery rate on patients diagnosed with COVID-19. The lockdown indeed helped. Our medical professions' responsiveness were important interventions in driving down the spread of the virus. And as I said earlier, this we did because of the collective action that we embarked on. From our side as communications and digital technologies, it has really brought the sector together, because you would have noted that most governments, us included, when we made legislations, when we developed policies, we were inward looking. Now it forced us to say, you don't make a policy for yourself, you're making a policy for the state. Everybody must be able to realize the strategic intent of your policy or the economic perspective of your policy. And therefore, it therefore means that certain things we've got to relax and not put pressure from ourselves as governments, because we can't afford everything. We've got to work together with the private sector. And as I said, COVID really enhanced our collaboration with the industry, that to date, as I'm speaking to you, there are certain things that we say the industry will take care of. Ours is to create an enabling environment for them to go to these areas that I said were not connected. And we are about to, of course, release spectrum through our regulator, which we also believe will help minimize the impact of the digital divide. And we had then agreed with other departments and the private sector on the need to promote local innovations, as much as we appreciate that we operate in a global platform, but those innovations must still have the South African and African character, which talks to us, including the importance of using our local languages. Wherever we're deploying drones, wherever we're deploying robotics or artificial intelligence, looking into the ethics also of the algorithms by those that are programming is something that we said, we've got to pay attention to it. We've seen, like now, if you look at the likes of Facebook, even if making an example, if you look at the list of people that get to invite you or send you friend requests, if you are Black, it's totally Black people. And that talks to some of the things that we never pay attention to, but we believe that now it's high time that we look at it. If you look at the spread of the virus in terms of the numbers that are given, you find that still you find those that they still exist whereby they discriminative against certain skin and certain colors. And we are saying working with yourselves in order to drive the digital transformation that was adopted by the AU, we believe that we can take Africa to a better continent. And of course, utilizing contact tracing as one of the interventions, but bearing in mind that we have a responsibility to protect the people's information. And that's our story, Program Director. Thank you so much.
Thank you so much, Madam Minister, my dear sister. Thank you so much for that. And congratulations. I think, let me, from myself and from the African Union Development Agency and the organizers, to congratulate the government for the marvelous work you've done. in communication. I work from South Africa, and it has been really, information flow has been just there. You know, what you want to know about the pandemic, using all different platforms that the government has set up through your ministry. I think it wasn't shortage of information that was necessary, whether where to go test, where to, what information you need. It has been very good. I think the government has done a fantastic job, and we want to congratulate you. There are questions that are coming, but two key things that stand out for me is what you're talking about, policies and building equity and resilience in our policies design, so that those communities that have been marginalized before, and COVID-19 has exacerbated this marginalization, have to be attended to urgently. The second point you mentioned also is working with private sector, and the government really putting through its policies, enabling conditions for private sector to invest in this technology. So thank you so much. There are questions, and I'm sure you will have time to respond later on. Thank you. At this point, let me invite also my dear sister, Her Excellency Professor Sarah Agwo, the Commissioner for the Department of Human Resources, Science and Technology of the African Union Commission, to make her intervention. My dear sister, you have the floor.
Thank you very much, my sister, Mrs. Estherine Fortabon. Your Excellency, Ambassador Kwesi Kwate, the Deputy Chairperson of the African Union Commission, the Honorable Elegant Minister of Communications, Mrs. Stella Ndambeni Abrahams, Mr. Abdelatif, esteemed presenters, thanks for the insight you have given us to see how STEM can mitigate and respond to the COVID-19 pandemic. Distinguished participants, it is my pleasure on behalf of the Chairperson of the African Union Commission, His Excellency Dr. Musa Faki Mahamat, to welcome you to this first session of our several series of webinar meetings on women in STEM in Africa and the COVID-19 pandemic, an occasion for us to rub minds on how we can jointly win the fight against COVID-19 as women. Before I go on, I want to extend sincere gratitude to the United Nations Office for South-South Cooperation for collaborating and co-hosting this high-level webinar. Indeed, considering the role of the African women in STEM, this is a momentous moment. Sincere gratitude to my boss, His Excellency Ambassador Kwesi Kwate, for accepting to give the opening remarks at this Women in STEM initiative. Esteemed participants, profound gratitude and respect to all frontline workers, particularly women and girls on the forefront, mitigating the impact of COVID-19. And congratulations to the presenters for the works you are doing. I think you should become mentors for many girls in Africa so that they can know that they can do science and still remain fashionable and in vogue. The way I saw you, I'm very proud of you. We cannot overemphasize the role of STEM, science, technology, engineering, and mathematics in combating COVID-19. The pandemic that is ravaging the whole world is a clear evidence of lack of adequate science and technology to deal with the pandemic, right from the STI infrastructure to human capital and knowledge that is urgently required to respond to the scourge are insufficient. The pandemic has exposed the scientific and technological weaknesses of the world at large, and Africa in particular, to deal with the pandemic. This we discuss on the occasion of the Women in Science webinar, Winning the Fight Against COVID-19, August 26, 2020. The African Union recognizes that women are very powerful and can really make a change. And when we speak of inclusivity, we must bring women and girls to the forefront and co-create with them in order for them to be able to articulate and put their contribution to the Africa we want. The Department of Human Resources, Science and Technology and the UN Office for South-South Cooperation are very pleased with this series of webinars on women and the COVID-19. And the focus of the series of 7 webinars is on African women, COVID-19, frontline responders, and their contributions to STEM sectors. According to the ranking of the Global Gender Gap 2020, The top 10 countries in the world having fought the most effectively against the COVID-19 are headed by women. This ranking underlines women's leadership on managing humanitarian crises and shows us women's competency in decision-making. The COVID-19 pandemic should not overturn assets already won by women in the STEM. We must preserve this treasure in terms of parity, in terms of policy adopted by our countries to mainstream gender-related issues into sectoral development programs like gender-sensitive budgeting to guarantee and encourage qualified women represented and participating in STEM and in TVET male-dominated fields. Ladies and gentlemen, today we are seeing a global competition among pharmaceuticals firms to find the best COVID-19 vaccine, and several laboratories are on foot to demonstrate their competency. The question is, and what we should ask ourselves, how many female pharmacists, medical doctors, laboratory technicians, biologists, etc., are among these groups of experts, and what is their role and expertise in the whole research process? It would be interesting if statistics could be produced on their participation. The Gender Education Strategy for Continental Education Strategy for Africa 2016-2025, jointly elaborated by the African Union and FAWE, reports that in the next 10 years, Africa will be impacted deeply by information and technology changes. It is therefore imperative that the current generation of all Africans, including girls, adolescents, and young women, pursue STEM-related careers and businesses. STEM education is concerned with developing adequate mathematical and scientific foundations in girls and boys and young people to be more competent in the 21st century workplace. The African Union, with the vision of an integrated, prosperous, and peaceful Africa, driven by its own competent and skilled citizens, is responding positively to the challenge by promoting STEM in Africa. The African Union, through the Science, Technology, and Innovation Strategy for Africa 2024, recognizes the need and significance for science and technology in the development of Africa. The strategy underscores the need for African Union member states, regional economic communities, and other key partners to contribute towards raising the profile of STEM and building a STEM culture amongst African countries. Significantly, African member states need to urgently promote gender socialization for STEM and de-stereotype the systems where girls and boys can play, learn, and grow up together. African member states need to reflect and create an enabling environment where girls can thrive in science so that their success becomes as probable as they are capable. This cannot be achieved without teachers. Indeed, teachers have an important role in perpetuating or changing gender norms in STEM, and this aspect must therefore be included in both the initial teacher professional training and the continuous professional development. Increasing the number of female teachers in STEM who will also serve as role models for girls can debunk the STEM gender stereotype. The African Union Center for the African Union International Center for the Education of Female and Girls, the AUCFR, a specialized technical office, has as mandate the promotion of girls and women's education in Africa, as well as the coordination of actions and interventions with all relevant stakeholders to work together towards achieving women's economic, social, and cultural empowerment through Agenda 2063, the Continental Education Strategy for Africa, and the Science, Technology, Innovation Strategy for Africa. In order to optimize efforts which are the most needed and which will have the highest impact on girls and women's education in Africa, the AUCFR has identified STEM education-focused TVET for girls and women as one of its 4 key strategic priorities for 2018-2020. The AUCFR is striving to ensure gender mainstreaming in the educational system, encouraging more qualified women in STEM jobs, and working in an environment without gender stereotypes. Unfortunately, there are still persisting social norms harmful and traditional practices, ineffective policies, poor infrastructure. The AU-CFR ensures political commitment and support from African Union member states in investing in gender-responsive policy planning, in gender-sensitive learning and teaching environments, in girls in STEM and TVET in order to boost girls and young women's access to the labor market. This we have seen from the presentation of the Honorable Minister, where the leadership is focused on improving the lives of the people and creating sustainable development. They are able to put the right infrastructures in place. Those are the best practices that we need to take from one another in order to effect this change that we want in Africa. Indeed, women scientists can also play a greater role beyond research by contributing to gender disaggregated data. This information can help us to know exactly how the virus impacts differently women and men, the economic benefits and impacts on the spouse's life during the global lockdown, especially at a time where we know that the number of domestic violence and sexual abuses has steadily increased. I would like to strongly recommend to our African Union member states that when they are voting their national budgets, they remind themselves how COVID-19 has affected differently African women. Our national budgets in line with COVID-19 should be voted with an added gender lens. Distinguished ladies and gentlemen, the African Union has made several technical and policy level incursions into realizing the opportunity and challenge presented by digitization across sectors, including in education and skills development for children and youth. The Continental Education Strategy for Africa identifies ICT, STEM in education as major levers for promoting access, quality, impact, and inclusion, as well as a skill set for life, work, and further education. Women in STEM, as exemplified by the elegant and charismatic presenters, provide an avenue to harvest Africa-led solutions to African challenges, solutions that need minimal adaptation as they are contextualized. You will agree that these are needed more than ever as governments scramble to find solutions which can be deployed quickly and at low cost. Esteemed participants and panelists, excellencies, it is only when we can identify the skills needed in the next decade that we can prepare pedagogically to ensure our curricula is relevant to the changing times. STEM can give possibilities for innovation, entrepreneurship, and employability, enabling inclusion for children and young people who have been excluded for many different reasons, and enhancing access to STEM skills and careers, especially for girls. Digital skills are now recognized as basic skills, along with literacy skills and numeracy. I would like to conclude my remark by quoting Her Excellency President Sahle-Work Zewde, the President of the Federal Democratic Republic of Ethiopia, who stated, I quote, "Lockdowns have put more women at risk. We must remain vigilant that COVID-19 is not used as an excuse to restructure and under-prioritize the programs and projects earmarked for women now and post-crisis," unquote. Indeed, there is a need for us to recognize women's role in STEM, and the underrepresentation of women in STEM is a cause for concern. Yes, Ubuntu will say, I am because we are. Collective responsibility, coordinated collaboration, partnerships with good institutions like the UNOSCC can make us stronger, because I believe in the spirit of Ubuntu that I am because you are. My existence depends on you, and your existence depends on me. Together we are stronger, and we can make a difference if strategic linkages are established. Women in STEM can turn the world over and bring solutions to what we need. Thank you very much for your kind attention. Masa Ginalo, as we say in Amharic, Shokran, obrigado, thank you, merci beaucoup. I'm sorry.
Thank you so much, my dear sister, Her Excellency Commissioner Sarah. I think one can just see and feel the passion coming out from your statement. And thank you and congratulations for all the excellent work you are doing in the Department of Human Resources and Security. You have, through your period, the last few, you have there developed policies, particularly raise the profile on STEM. I think we really want to congratulate you and appreciate you for that excellent work. Bringing this issue at the highest political level means that our governments also will reflect this in their own national policy. So you have the issue of mentorship, you've brought that very strongly, and listening to you and Minister Ndembele, yes, I think you should be the first to, and the rest of the panelists in this webinar, to start this mentorship program. Excellent presentation. You've raised the issue of gender mainstreaming in policies. You've raised the issue of national budgeting reflecting the STEM and gender issues. You have raised the issues of TVET, not only university education, but TVET training, important for girls in STEM. A lot of points you have raised there, and I think there will be time to engage with these issues. Thank you so much for your leadership in driving this issue in the continent.
Thank you.
Let me invite the director, Mr. Abdulatif of the UN Office of South-South Cooperation. Mr. Director, you have the floor to join these beautiful two ladies to give us your own statement and a response from the UN system on the issue of STEM. Thank you.
Thank you very much for inviting me again to address this very interesting and promising webinar on women in STEM in Africa. As I mentioned earlier, you know, what we are discussing today falls at the heart of Agenda 2030. We are in fact discussing two of the main goals of this agenda: the goal on education, goal 4, and the goal on gender, which is goal 5. Maybe it is not a coincidence that both of them are very close to each other, 4 and 5. And from our side, you know, I would like to emphasize in my intervention that the United Nations Office for South-South Cooperation Africa is at the heart and the focus of our work, not for the challenges that Africa is facing, but because it is also the promising continent Africa has, with its youth, can make a lot of difference for the future of the whole humanity. And that, of course, will be good for the whole humanity and for the African people. But having said that, I would like to situate, you know, how we see this challenge. The challenge that we face is not only a gender challenge, but there is also another challenge that Africa in general invests very little in research and development. And that, of course, would require that the African leaders address that. And in fact, you know, it is in Agenda 2063, there is a reference, you know, how Africa increase, you know, its investment in research and development, because that, of course, will attract young people, you know, to STEM, and will also help also to attract women with the support, of course, with the efforts from the governments, the private sector, and civil society, and international organizations. So we have to address, within what we are talking about, the issue of increasing the investment in research and development. And also, another issue that we have to address is the question of access to internet and access to digital economy, because as we know, in COVID-19, it became, you know, the internet and digitalization is becoming an imperative. You know, it is not a luxury or something that we can use or not, but we have, you know, to ensure that the access to the internet is available to all the people. And that brings me to the issue of at the heart of Agenda 2030, which is the issue of leaving no one behind. So when we address the issue of STEM and women in STEM, it is falling at the heart of leaving no one behind. So women should not be missing this, not only because it is the issue of equality, but it's the issue of what women also will be bringing to science, mathematics, and technology. They're coming with the perspective that's very much needed, as I mentioned in my intervention. I would like to remind, the audience, that was something that when we were preparing for this webinar, with a publication that came by UNESCO in 2018, with the title, Cracking the Code, Girls and Women's Education in Science, Technology, Engineering, and Mathematics. And we would dream, to do something, cracking the code for women in STEM in Africa. Because, of course, the publication by UNESCO was about the whole world, but we would like to crack the code for Africa to see what it should be done in order to enhance the involvement of women in STEM. And that, of course, will focus very much on the issue of education. The challenge here is how we can work on, of course, equality in education, and in particular also how we enhance the enrollment of women in areas related to mathematics, science, and technology. We would like also to remind the audience, that in many countries of Africa, what we call the trends in mathematics and science, which many countries in the world are also adopting in order to measure, the performance of children in 4th and 8th grade, that many developing countries are actually taking to improve their education. Very few African countries actually are doing that. And that would help us, of course, to understand clearly where African countries are lagging and where also the gender issues, within this. Only maybe 2 countries in the continent, South Africa and Ghana, and some countries in North Africa are doing it. But I think with the help of international organizations, we can help in adapting this and to the whole continent in order to make sure that we can contribute to the progress of women in STEM. Of course, one of the things, that we would like also to, that's how I would like also to finalize my intervention, that the African Women in STEM platform will be a very important tool, of course, to connect women in Africa, and also be a good platform to share experience. And we have today very good role models, excellent role models, that we have always, to show how women in Africa can excel in STEM. But we would like that we keep them in Africa, because also as Ambassador Kwesi said in his intervention, a lot of the brain drain from Africa, we have also to find a way to stop that and keep the talent, of course, women and men for the continent, because that will also help in keeping and pushing the education on STEM in the continent. I would like to finalize my work by thanking everybody for contributing to this webinar, and thanking my colleague Francois, who actually did not talk until now, because he has been actually very active in organizing this webinar. Over to you. Yes, Esreen, I finished my intervention.
Yeah, thank you. Thank you so much for your statement. I think now we will, the contribution have been so rich, and I have been reluctant to cut the presenters and the panelists because there's so much to share. So we've added a few more minutes to the webinar. I think we have about 30 minutes more. So we will now take questions that have been presented, have been raised by the participants. We won't be able to take all the questions. The colleagues have documented all these questions. Some will be answered in provide written answers that will be on the website provided by the colleague Cynthia earlier. But we will just ask a few and get some responses to from the different panelists. So a few that came up, I think there was one for Dr. Gitau. There was a question about that was quite interesting one, whether the model was meant to scare and frighten the government to actions. I'm smiling, but I'm sure you'll be able to you'll provide some response to that. And the other one was, would it be interesting to compare the projections from the expert and the actual evidence on the data on COVID incidents in Kenya? So those were quite specific questions that were asked to Dr. Gitau. There's another question on what efforts have been put in place to produce COVID-19 vaccines on the continent. I think perhaps the commissioner might speak to that, and any other panelists who would want to. There's a question on the infrastructure, like how can the AU and the continent solve the problem of electricity infrastructure in the continent? I think those are some key ones. And of course, this one that is so many people are commenting on the mentorship program. So what will be the view of the panelists and the speakers on that issue? So these are some of the questions. As I said, there's a few others, but given the time constraint, we might not be able to answer everything. But if we can start with these ones, I think that would be a good place to start. So Dr. Gitau, and then any other speaker who would like to take the floor and respond to the questions before in the same time, I think you can also use this opportunity to just make your last remarks as we close the session. Thank you.
Thank you very much, Chair, for the questions. So, I mean, I understand why you're smiling when those questions were being asked. So initially, when we started the modeling work, we were using models and data from China and from Singapore that had gone before us in terms of the pandemic. So we were using the R0, the incidence rate from other countries, showing that if we have like one person spreading the disease to 3 to 4 people, this is how we are going to do as a country. And as the pandemic, of course, that gave us really huge numbers. I remember our first model was showing that we'll be able to hit 10,000 people by mid-April. Within 4 weeks of the pandemic, we'll be able to hit 10,000 people. And that was a bit scary because we know very well that the country will not be able to handle 10,000 highly sick people. But as the pandemic evolved, we started getting our own R0 and being able to calibrate the model to be more similar to what we're expecting. So that's why the numbers, the dates kept shifting, the numbers kept shifting because we started getting our own clinical data. So as I mentioned, SEMA, the center that we founded because of this pandemic, that it's going to evolve into something big, is we have clinicians and epidemiologists from the University of Nairobi and people from the Ministry of Health who are giving us actual clinical data from the ground, from actual incidences that helped us like calibrate the model to something more accurate. And if you see the much later models that we were producing, they were very, very accurate to what's happening right now. And no, it was not to scare the government. We were trying to make sure, you'd rather be cautious than sorry. So we were saying, let's give you the worst case scenario, not give you like any hope so that you can take actions. And we are so happy that they did actually take actions. And some of that, yesterday there was a huge conference in Nairobi around the COVID-19 response, and it's those early response measures that are taken that actually saved the continent from a huge outbreak of the epidemic. The numbers compared to the clinical data, yes, we have been comparing the numbers. If you go to like the Kenya Health Observatory, it's a website. It has live data and it shows both clinical data and modeling data. You'll see there's actually a point where they actually were matching according to what was being reported and what we had modeled. And I mean, and that has evolved. Right now, the incidences have started. I mean, we are flattening the curve, as we are calling it. At least we are flattening the Nairobi, in Mombasa, the city curve. The rural area might be a different case altogether, but we're flattening the curve. But that is how we are doing it. We're taking clinical data and trying to project what might happen to the country. So yeah, so no, we're not scaring the government. And the second thing, yes, we are actually looking actively on clinical data. Thank you very much.
Thank you so much, Dr. Kitao, for that reassurance. Are you absolutely right, though? It's better to show the worst case scenario and then the right appropriate actions can be taken. Please, the floor is open for any of the other presenters to take the floor and provide a response. There was a question on the issue of vaccine development in the continent. We want to take maybe our sister from Ghana, who's been involved in clinical work before. Hello, I'm just asking Dr. Agostina, will you like to take the floor?
Yes, thank you, Estherine. So in terms of vaccine, for Ghana, I don't think we have gotten there yet. Well, we see some herbal concoctions being displayed all over as potential cures, but we all know the stressful research procedures that vaccine development needs to go through. So as a country, for Ghana, we still haven't gotten to the moment where we will say that we have a vaccine. Thank you. Just so maybe my closing, in terms of my closing remarks, I will also push for a well-structured mentorship program for young girls. I keep on saying that the girls are very, very brilliant. The only challenge is that they don't have people to inspire them. They don't have people to look up to. They don't have people to direct them. They don't have people to encourage them. So I hope that based on this particular webinar and all the things we have discussed, we will be able to come up with a very good and a well-structured mentoring system. Thank you.
Thank you so much. I think we hear you. I think you raised the issue of traditional and indigenous medicine. I hope that that might be an issue for a discussion in one of the webinars in the series. So maybe Dr. Ikoko, who I know is passionate about some of the subject, is listening, and we'll discuss with our sister commissioner to see whether this might be something we will discuss in one of the series, a webinar series. But that's a bit important point that you raised. Thank you. Let me call the other speakers to see if they can make just 1 minute last remark, final remarks. So we have heard from Dr. Gitao, from Dr. Agostina. Maybe we can hear from Dr. Mumbeke. Sandrine, your last comments. So 1 minute final remarks.
Hello. So once again, I think what we all have learned from COVID-19 is the need to really invest in STEM education for men and women throughout Africa and throughout the world. So I really think it's important to have that mentorship program. You know, leading an organization such as the STEM DRC initiative, which has about 500 members, we see the need for a strong mentorship program. So we would be eager to assist you in you know, contributing to that mentorship program for STEM education. So thank you for inviting me again.
Thank you so much. It looks like this mentorship program has a lot of champions. Can we hear from Dr. Bello? Just 1 minute, please, final comments.
Yeah, thank you again for inviting me on today. I think I'll have to also go with the ladies with the mentorship program. I mean, here at CamDoc UK, we're quite keen on doing that. We do that with our members, the senior doctors do help the more junior ones. But one other thing that we've actually also realized is that with this virtual way of working, that we can provide, you know, educational lectures to some of the universities. Obviously, some of them are not having any lectures at the moment. That's something that CamDoc UK is actively looking at, working with, you know, so we're Cameroonian, so looking at how we can work with the universities back home, give them support, give them mentorship. So much can be done via Zoom. You know, we've started doing some journal clubs, discussing papers, discussing how we do things here. So I think, you know, the future is looking really bright in terms of how we can affect, you know, change without actually necessarily having to travel back home. And of course, CamDoc UK are still going to be continuing to fundraise to help with other aspects of healthcare in Cameroon.
Thank you so much.
Thank you.
Oh, good. Oh, thank you. So maybe we can now hear from the from a high level. Sorry, the panelists. There was maybe a specific question that went to the minister on the availability, accessibility, and affordability of data and digital gadgets to learners and students throughout the country, to enabling them to learn. Data is still expensive in SA to the middle class, and this leaves the poor core. That's the observation, Minister. Do you want to respond to that? Just a quick response.
Thank you, Program Director, once more. And it is true what has been mentioned in terms of the challenges that we have in the ecosystem of building the digital society. It's not only access, affordability to the technologies, but also the skills that are required, of which we talk about ensuring that we do away with the digital illiterates in order to make sure that our people can participate meaningfully. One of the key things is to invest in the skills development program. I will make an example with South Africa. What we did was to conduct a skills gap analysis on the digital skills. And after that, we then make sure that we develop a skills strategy, digital skills strategy for the country to say what are the key skills that we think we need. Based on the report again that we got from the Presidential Commission on the Fourth Industrial Revolution, which identifies key technologies, we said, let's merge the two, look into investing in human capacity development, whilst we're also looking at ways to re-industrialize the electronics industry. That's where we're talking about the availability of these technologies and the cost that goes with it. Even if others won't be African and South African produced, but to say, how do we lure the investors to come and open their plants here in South Africa and therefore be able to incentivize in order to drop the cost? That's one of the interventions that we are saying we can make, both South Africa and other countries that are in Africa. But the other key thing is the issue of investments into the STEM. As we talk about research and the actual costs that we're talking about, we have not, as governments, been investing much in research and the STEM subjects. Therefore, we're saying there's a need for us to coordinate all the grants, all the bursaries that are availed by government and the private sector to respond to the key skills that we are saying the countries need in order to leverage in the digital economy that we're talking about. And key to that is those 1% levies that are there. We're not saying governments must come up with new ways or the private sector must come up with new ways, but to say, how do we prioritize? Is there a need for myself in the Department of Communications and Digital Technologies to invest in human resource management skills, whilst I know that my department is too technical? I need to make sure that I enhance that through software developers, data scientists, all those key skills that we are talking about. That is why I'm proud to announce right now to you that as part of the partnerships that we have built, we will be training about 50,000 data scientists in South Africa. This is the partnership that we have done with the Department of Higher Education and Coursera, the online platform. We then reached out to the industry to say, can you provide the devices for them? And then we're looking at connecting those. These are what we are saying, when we work together, we're able to minimize the impact and also see the great impact that we can have for the effective execution, because I get to benefit as government, but at the same time, the private sector gets to benefit because there will be more innovators that will help the private sector be innovative and responsive to the people's needs. So I think governments should make sure that they come up with clear strategies in terms of human capacity development and investing in STEMs. Of course, most of my colleagues here and the sisters have mentioned the issue of mentorship, the importance of promoting the girl children in the STEM subjects. And that is one thing that we really have to make sure that we all build on. Thank you, Program Director. I'm sure your 1 minute is gone.
Thank you, Minister. Thank you so much for that response. And it's so rich. I'm building on your response on the 50,000 as trained, and asking Her Excellency Commissioner Sarah on how do we ensure that we retain those who are trained, bearing in mind the critical shortage in infrastructures that we have.
Thank you very much. Thank you very much for that question. It goes in line with what the minister has said, because now we need to have strategic linkages. The education must move with the plans, the development plans of the policymakers, and then move with the private sector. That is why in many developed countries, they have a technology transfer office where a student discovers an innovation, they link the student to the private sector. Now, what we need in this continent now is that we need to, the policymakers need to work with the academia as well as the private sector, who are the financial gurus, to bring some of what they need to place. Now, I haven't answered that question. One question was, how can the African Union solve the problem of electricity in the continent? The fourth industrial revolution indeed. So you see, what they've done is that at the January-February summit, they came up with what they call the African strategy for digital strategy to transformation. So this African digital transformation strategy is to build on the energy infrastructure. The other question that was asked is that what has the African Union done to respond to the COVID-19? The first thing is that the African Union Commission, under my department, convened the first extraordinary virtual meeting in the Specialized Technical Committee on Education, Science, and Technology on 30th April to consider the sectorial response of education, science and technology, and innovation to the COVID-19 pandemic, and share national experience and strategies to control the global outbreak of the coronavirus pandemic. This has also been done under the sector of agriculture. It has been done under the sector of trade and industry. It has also been done under the sector of economic affairs, political affairs, and peace and security. Because when we speak about this COVID-19, it has a multi-sectoral effect, because hunger is affected, poverty is affected, the youth are affected, and it touches all strands of life. So what have we also done? There was an STI response to underpin the following measures. The ministers of science decided they need to establish R&D platforms at national, regional, and continental levels. 2, they need to invest in data science capacity for modeling and analysis and promote data collection, access, and sharing of COVID-19 research and development through open science principles to bridge the science, technology, and innovation inequalities in Africa's R&D landscape. And I was happy that some of the presenters mentioned this. Then we need to, they spoke about the need to put in place a mechanism to access funding for research and development for COVID-19 and other disease outbreaks from continental and international funds established to mitigate and fight pandemics. And we know that we have the African Fund for COVID-19 that is being led by the chairperson of the African Union Commission, who is His Excellency Ramaphosa. So, and then we have the African Scientific Research Innovation Council. This African Scientific Research and Innovation Council is mobilizing the scientific community to carry out studies on impact of COVID-19 on Africa's indigenous knowledge to preventing and controlling emerging infectious diseases on the continent like COVID-19 using an Afrocentric response. African challenges to African solutions to African problems. These solutions to African problems should be found in Africa by Africans and friends of Africa, because we live in partnership and collaboration. So much is on the ground, but what we need is to walk the talk, move beyond rhetorics, and begin to implement. That is where we are.
Thank you so much, Commissioner. Thank you so much for those responses and those closing remarks. I hear from you, African solutions to African challenges, and we should walk the talk. And the minister, I like what you said, connecting the unconnected. Treat our people equally. So those two things from both of you are really policy orientation and guidance that really will drive how we move with women in STEM. We are rounding up. I think I called all the panelists, but I missed Dr. Linda Mabula. Dr. Mabula, please, if you can just 1 minute, give your last comments so we can then have the closing remarks. Thank you.
Thank you. Thank you again for having me. It was such a pleasure to meet everybody and to hear about everybody's experience in multiple countries. I agree that mentorship is important, but I also think that internship opportunities for on-the-ground, hands-on experience is also important. So I think it would be a good idea to think about internships for STEM, for women in STEM, young girls, to actually add experience to their CV, to their resume, so that they can actually be more marketable as they look for jobs. I think that's also extremely critical. I think we've learned a lot from the COVID-19 experience, and I always look back at Ebola as well, and I think it's important to focus on essential services and to think about the response as an integrated response to ensure that there's not increased mortality from other diseases like malaria or maternal or infantile mortality. I think it's important to look at the entire health system and strengthen it in the future so that we have more robust systems to prepare and to respond to outbreaks. And I think this is done by working collectively as African countries, as Africans, and to have a localized response, as everybody has said. And I look forward to working with everybody in the future. Thank you.
Thank you so much. Thank you so much. Dr. Coco, I'm sorry I'm putting you on the spot, but I think you've heard from all the panelists and the speakers and the presenters, and maybe your reaction to this widely endorsed idea of a mentorship program. Do you really want to say a few words? And first, thank you so much for being the brain and working with Commissioner and her team, and you and your team for this excellent work that we are having the webinar today. But this is 3 years of working that has gone into developing the Women in STEM initiative and the platform. So please, we would like to hear your voice. Dr. Ekoko? Cynthia, is Dr. Ekoko there with us?
Yes, should be on, but give me, yes. Maybe we can go to the next speaker as I ensure that his connection is working.
Okay, I think we're done with the speakers. Oh no, we have except UN Women, and we'll want to make a 1 minute final remarks. Is UN Women still with us?
Okay, thank you. Thank you, Madam Moderator. Can you hear me now?
Yes, we can hear you. I'm glad you are online. Thank you.
Well, thank you very much for accepting this responsibility. I would like to thank first all the panelists, the participants, and the presenters. I wanted to jump on the issue of the the mentorship program or necessity. The African Wisdom platform that we are currently building has 4 pillars, and one of the key pillars is on education and mentorship. In the coming weeks, we are going to unveil our strategies because there are many dimensions, physical and online dimensions that we have to take into consideration. And also because the platform is an integrated platform, we have to bring in all the mentorship initiatives that are already ongoing on the continent. So in the next few weeks, we'll be able to unveil our strategy on mentorship. Thank you very much.
Thank you so much, Dr. Ikoko, for that additional information. So we already have a tool or a mechanism that we can use to do this mentorship program that everyone has called for. So thank you so much for that information. So maybe I can ask, is UN Women still there? If they want 1 minute to make a last minute remark, or if our colleague from Intel Corporation is still there, Susan, to just make a 1 minute remarks if you want to.
I'm sure. I think I'll say, first of all, it's very inspiring, like I said, to be around people who are thinking like this. I keep telling other women around me, if I had access to older, wiser, experienced women when I was younger, I'm sure I would have been able to do a lot more than I have now. So, and I would like the opportunity to give that to, not that I know everything, but at least share what I know with younger women. So I absolutely endorse the plan to have a mentorship platform. And overall, this program is fantastic. And again, congratulations to the work that has been done so far. And I look forward to being part of the future.
Thank you so much, Susan. So we have UN Women now, Madam Ito. Are they online? Well, if not, well, I just really would thank everyone for such a rich discussion. We really cannot, I can do full justice and given a summary of all the points that is being captured, and the report of this conversation will be put online, both in the UN Office of South-South Cooperation, but at the commissions and at AUD and NEPAD. We will also but let me quickly say what has come through is African women in STEM are making a difference in the fight against COVID and beyond. All the presenters, the excellent presenters and innovators, we've seen what they are doing and what they can do if they are supported. However, their contribution is unreported, is underreported. Similarly to all the excellent work, policy initiatives and investment programs that the African Union is doing, as well as the government of South Africa is doing. A lot is going on that we could share more. And this gap, this communication gap, as most women in STEM do not have this information on other women working in the sector. It's really one of the reasons why we are doing this webinar, and one of the reasons why the African with STEM platform as an integrated digital platform has been designed to fill this gap. So we hope, as Dr. Ikoko said, mentioning the 4 pillars, this becomes a pivotal for women in Africa and in the diasporas, as well as men, to engage and share information in the area of STEM. So I just want to really thank you all for this really great webinar, the information that has been shared, and I'm looking forward to the next one. But as we round up, let me just call, I think some colleagues who will give some vote of thanks, and that will be the Deputy Director, Grace Wan, of the South-South Cooperation Office. Please, you have the floor.
Thank you very much, moderator. I'm very humbled today to express our vote of thanks. Of course, the United Nations Office for South-South Cooperation is very grateful for His Excellency Ambassador Kwasi, Deputy Chairperson of AU Commission, for his leadership support. And today we benefited deeply from our distinguished panelists, from Honorable Minister Stella Abrahams, Commissioner Professor Sarah Akbar, my dear sister, and our director, Mr. Adel Al-Galati. Special contributions from Intel, and also quiet, but I know very strong support from UN Women. Congratulations to all the presenters for sharing your brilliant experience. You have demonstrated commitment to your community, actions taken in partnership, and most importantly, you set role models for women and girls to take leadership in this critical area of STEM and applying your knowledge for building a better Africa and better world. And all these insights and knowledge have been so nicely and patiently moderated and put together by our excellent moderator, Mrs. Estherine Fortabon, the director of ALDA. Thank you very much. UNOSSC is very honored to work with all of you to champion the Women in STEM initiative. A very meaningful initiative, as we all heard from you, by African and for Africa, and to be shared with others around the world. It would not be possible without the vision of, visionary leadership by Professor Sarah Akbar, for her strong drive and determination to advance this in the continent. Dr. Françoise Ekoko is the one who not only initiated the concept, but also translated all this vision into action with his very able team, including Cynthia Alusa for her hard work, and also Ivania Montelaine for her support. The African Wisdom Provisional Secretariat had made immense contribution to put together shaping this platform. So many partners are contributing their wisdom and engagement. The UNDP Regional Center, especially the gender team, UN Women Multi-Country Representative, Mrs. Anne Songwei, Mrs. Wawa Damamin, and Irene Tamajong, Gloria Mohalko, Ms. Larissa Akrofi of the Lovers in the Hills, all shared their rich insights and strategic advice. I'm only naming a few. When I was invited by my senior colleague, Regional Chief Dr. Ekoko, who has provided me with this record-long thank you list, I was actually very humbled and touched deeply in my heart reading that list. It reminded me of the African proverb, it takes a whole village to raise a child. If this initiative is only a 3-year-old toddler at this stage, I truly believe that with many African women and men, sisters and brothers, as mentors and partners, will make it grow up with full nutrition of knowledge and wisdom, and make impactful contribution to a better Africa and a better world. We hope to continue this journey with you all and see you at the series of webinars on the subject that will follow. We also welcome you all to connect on the South-South Galaxy platform, a knowledge sharing and partnership brokering platform powered by like-minded people, partners, and facilitated by AI. So thank you very much, and wish you all a successful journey together. Thank you.
Thank you so much. Thank you so much for that vote of thanks. Let me just again thank the Deputy Chairperson of the African Union Commissioner, my brother, His Excellency Kwesi, to thank the Minister Dembele, to thank the Commissioner Siragwa, to thank all the presenters and all the participants for really taking your precious time to participate in this meeting. And together, I think we can make a difference in women and STEM. And the African Union Development Agency is looking forward to working with, of course, our sister, the Commissioner, and Francois, Dr. Ekoko and his team to ensure that we take this initiative to the country level and the sub-regional level, because we want to engage women and to encourage our younger ones to get involved in the STEM initial subjects. So thank you so much. It has been an honor for me to moderate this very, very rich discussion, and I look forward to the next one. I might not be the moderator, but I will definitely be the participant. Thank you so much for this wonderful opportunity. I think we have come to the end of our webinar. Thank you again. Thank you.
Thank you.
Thank you, Madam Moderator.
Thank you, everyone.
And thank you, colleagues, Shans, Raphael, quietly supporting.
Thanks, Cynthia. Thanks, Grace. Thanks.
Thank you.
Thank you. Bye.
Thank you.
Thank you, everyone.
Bye.
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 Thank you.
And look forward to the next one. Please come.
Yes, please. Let's meet here next time.
So